When I see someone with perfect skin, I often think to myself, maybe she's born with it, or maybe it's spironolactone. No joke, spironolactone got me through that awkward adult androgenic testosterone-driven acne of my late teens, early 20s. And I know a lot of people, including many of my patients, use it for their skin. So I want to talk about what spironolactone is, how it works, and what you need to know. This is a medication that was originally developed as a diuretic to help with high blood pressure, and now it's widely used in reproductive endocrinology to treat signs of androgen or testosterone excess, like hormonal acne, oily skin, excess facial hair, or even excess body hair, known as hirsutism. So how does it work? Well, it's a very clever mechanism. It blocks the testosterone receptors in your skin. It actually also lowers the overall testosterone production in your body. And this is why it helps so many of my patients with PCOS or other people that are dealing with hormonally related acne flares in their skin. Now, it is like a wonder drug. I will say my skin is less oily. It's so much clearer. I still take it till this day, but it's important to know it's not pregnancy safe. It has teratogenic effects, especially if you're carrying a male fetus, because it opposes the effects of testosterone. So for this reason, we tell patients to stop taking their spironolactone at least 1 to 2 months, 1 to 2 cycles before they try to conceive or undergo an embryo transfer to make sure it's fully out of your system. And here's a lesser known fact, and something I often uncover by taking a thorough history. This can cause irregularity in the menstrual cycle. So if you're having spotting, bleeding between your periods, and you just started spironolactone, that might be why. Another important thing to be aware of is that spironolactone can have side effects like low blood pressure. It can also cause high potassium levels. So most doctors, before starting you on spironolactone, will check your electrolyte levels with a simple blood test before they actually start the medication, and they may want to check in on this from time to time. It's important to stay hydrated and let your doctor know if you're feeling dizzy, lightheaded, or unusually tired. But what about spironolactone during fertility treatment? So if you're preparing for an IVF cycle where you're really just focusing on retrieving eggs, you might wonder if it's safe to continue. And we actually did a study looking at a lot of our egg freezing patients, because a lot of them are on spironolactone because they're not trying to get pregnant. And what we found was that taking spironolactone and continuing it throughout the ovarian stimulation actually did not have a negative impact or any impact at all on the number or the maturity of the eggs that were retrieved. We know that testosterone is a precursor for estrogen production, which is why there is this concern. But based on our data, we now counsel our patients that it's likely safe and okay for them to continue as long as they're not trying to get pregnant. While we know spironolactone is definitely not safe to take while pregnant, it can still be an option to continue during the egg retrieval process if you're not immediately thereafter trying to get pregnant, and depending on your unique situation. So definitely talk to your doctor about that. And if spironolactone isn't your cup of tea, there are other medical options to manage these types of symptoms. Metformin is a commonly used example of a drug that can help treat insulin resistance, and by making you more sensitive to the effects of insulin and lowering your overall insulin levels, this can drive down the production of androgens like testosterone from the ovaries and help to alleviate bothersome symptoms like acne or excessive hair growth. You also have options like the hormonal birth control pill. The hormones in the birth control pill drive up production of sex hormone binding globulin, and this acts like a sponge to soak up all of the excess free testosterone that can wreak havoc on our bodies and cause excess hair and acne. When prescribing birth control to my patients with PCOS for this purpose, I recommend a specific form that contains drospirenone. This is a 4th generation progesterone that has anti-testosterone-like effects. It kind of acts like spironolactone, so it works really well and is highly effective. Have you ever used spironolactone or medications like this? I'd love to hear your experience. Did it help your skin? Did you notice changes in your cycle or any other side effects? Share your journey in the comments.